Peter Thomas, and I'm representing the Consortium for Citizens with Disabilities. And I happened to be and was honored to be on the commission in 1997 and 8 that was chaired by Secretary Shalala and Herman. And that commission came out with a very strong statement that said the President should begin this effort, the health care reform effort, by articulating and continuing to emphasize a unifying statement of purpose of the health care system. I'll quickly read it. It's one sentence. The purpose of the health care system must be to continuously reduce the impact and burden of illness, injury, and disability, and to improve the health and functioning of the people of the United States. And I just want to make as strong a point as I can make that health care is not just acute health care, getting out of the hospital and being patched up, if you will. It's functioning in the community. It's using artificial legs and learning how to walk again after a bad accident. It's getting the rehab you need in order to do that. It's living with long-term services and supports in order to remain functional and independent and go back to work and stay out of an institution and not be readmitted back into an acute care facility. And that alone, if we look at health care from that perspective, I think can save billions and billions of dollars, because you're not going to have the kind of reoccurrences and the kind of heavy emphasis on acute care. There's legislation in Congress right now, the Community Choice Act, that would really level the playing field between home and community-based services and institution-based services, and that's critical to provide care in the home and in the community setting, especially for people with chronic illnesses and disabilities. And the Class Act as well, and emphasizing that long-term services and supports is part of health care and really must be part of health care reform if it's going to be a successful system. And finally, let me just say that the Medicare and Medicaid programs are just critical, and I think everyone would agree. But I really hope that we don't use those public programs, if you will, as dumping grounds for people with disabilities. I know there's been a number of discussions over the last several months where sometimes the assumption is, oh, well, don't worry about the folks with high costs, people with disabilities, chronic illnesses. There's always Medicaid. Medicaid and Medicare. Medicaid is a plan where you need to impoverish yourself in order to get access to those benefits. And I would just hope that when we talk about health care reform in the private market, it's covering everyone, so that really disability and chronic illness becomes a litmus test, if you will, for how successful the plan is. If it covers and takes care of and does well for people with disabilities and chronic illnesses, it's going to cover and take care of everyone.